Okay, what's up, everybody? We're super excited about today's webinar. New presenter here. We have Dr. Brett Winchester. He lectures throughout the world, teaching on a number of subjects, which are awesome, on his functional approach to patient care. He has an unbelievable background, and he was a technique instructor at Logan, did advanced biomechanics course at Logan. You can definitely see where his passion in this profession lie. But to be honest, my all-time favorite thing on the entire list of his amazing credentials was the fact that he was the team chiropractor for the St. Louis Cardinals. As y'all know, I'm a huge baseball fan. I met this amazing man through a mutual friend, Dr. Jay Greenstein. As y'all already know, we like to cut up on this webinar series on a regular basis. He's very involved in research as well on topics, especially with multidisciplinary approach for the treatment of the pregnant population and with foot dysfunction. Um, if y'all just saw, like, I could read his entire bio, but we would be on here for about 10 minutes, and then it's going to cut into the amazing information that he has. So we're going to make sure that this is listed on the website with the course description. And if you're watching the recording, make sure you go back and look at this. Because like I said, he has a really incredible background. He's been involved in so many different things. And y'all know I've already dropped like my favorite words. Multidisciplinary, biomechanics, research, baseball. But he really does have this really incredible background on top of having just really incredible friends within the profession. You know, if you get a Jay Greenstein seal of approval, I'm like, let's talk. Tell me all about yourself. And I'm really excited about this webinar, and I'm super, super excited that we were able to slide it in before the end of the year. So thank you so much for joining us today. And I'm going to turn it over to you, Dr. Brett.
Great. Thank you very much for having me. So today what we're going to talk about something a little bit different than what we usually do. And that is, we call it the IT factor. And these are kind of the soft signs of clinical practice and what creates your IT factor. So I have 20 years of experience in doing this. And one thing I've learned in 20 years is there's way more to success in practice than just what you're doing with your clinical techniques. And that's what I want to start exposing today, because I have many stories about myself over the years where I couldn't really explain, sometimes why certain people were getting results, why other people were not, even though they were doing the exact same thing. And what I quickly learned was there's this whole other side to being successful in practice. And for the last 5 years, I've really started to talk about it quite a bit, because I think it's really, really important. And I think the young clinicians and the students, they go through school thinking that if they're just the best chiropractor, that they're going to have, success in practice and they're going to have great results. And you're going to learn quickly, if you haven't already, that there's a whole nother side of that. So instead of talking about all the techniques and the research and things like that I usually do, I want to talk about some of these softer signs of success in practice. So we talk about the IT factor quite often with athletes. And when we use that term, it basically means it's an intangible. We can't explain it, whether it's Tom Brady, Michael Jordan, Wayne Gretzky, Tiger Woods, whoever, what example you want to use. For some reason, the bigger the moment, the bigger the stage, the better they're able to perform. And we call that IT factor. So we look at the research on even ACT testing, and certain people will perform greater during the big moment, while other people's will not, and vice versa. So we're going to talk about some of the things that help you with that IT factor, because in practice, one of the things at least we look for in our associates, we're looking for people who maintain or have this IT factor. So what are the different things that we're going to talk about today? So they're going to be the ability to confront. So that is, we call that the dirty C word. So that is sometimes, especially for our younger clinicians, they're unable to exude the certainty and the confidence to be able to confront patients on exactly what they need from a treatment standpoint. Obviously, we're all leaders within our practice, even if we're not the owner of the clinic, offering reassurance. I can't wait to show you all the good research on reassurance, customer service, doctor certainty. Doctor certainty, I don't have words to explain how important this is for your clinical results. Readiness, obviously mastery. So all of us are in this basically 70-year journey to be great at what we're doing. clinical excellence, situational IQ. We're going to talk about it all. Enthusiasm would be another big one. I think a lot of people, as you get to that 10-year mark in practice, a lot of times people just lose their reason or their passion for why they're still doing this. So I want to talk about what enthusiasm means, because it's a little bit different than what most people think that it is. Enthusiasm is basically knowing and understanding that you love your job, and the patient actually feels that. So this got exposed 20 years ago. So this is from David Butler's book, and I can't find this really anywhere else. So the book is called The Sensitive Nervous System. And what Butler talked about was we have what's called the wise action triangle. So you have the best of science, which means we're keeping up with all the latest evidence. We have the best of current therapies, which means we're staying up to date with all the latest and greatest from a therapy standpoint or from a technique standpoint within chiropractic. And then we have this one that's never talked about, and that is the best of the patient, which means how good is your relationship with the patient. And I always tell a hilarious story about myself where I was a student, I was a Tri-9, and I was doing my internship at an office, and they were having Dr. Stuart McGill, the PhD, was coming in that weekend to teach a seminar. And so the owner of the clinic asked me to find one of the difficult patients in the clinic that we'd been working with. So I picked this patient who's basically 10 out of 10 out of pain, low back pain. And I do all of Stu McGill's work on this lady for the month before. We're doing side bridging, bird dogging. We're doing manual care manipulation. We're doing hip hinging. And I'll never forget this. So I give this patient to Stu in front of all these people for the weekend, and I'm expecting Stu McGill to fall on his face. Well, he did the exact opposite. But he didn't do anything different than I did. He basically did the exact same treatment that I did and had a completely different outcome just by the way that he had owned the situation and his immediate rapport with the patient and his confidence and his certainty. Of course, he had written multiple textbooks. He had won the Volvo Engineering Award twice for his research on low back. So there was a lot of things that were kind of baked into the cake for his success. But anyway, so he gets done with this patient that day. And like I said, I'm expecting him to also fall on his face. Not only does he not fall on his face, the patient gets up from his encounter with him 30 minutes later and is like, actually, she's like, I think I'm a 1 out of 10 now. I'm like almost 100% better. And I had done the exact same thing with this lady for the last 4 weeks. And I learned a valuable lesson at that point, that who delivers that message actually matters. Because remember, Stu McGill did nothing different than what I did. He just entered the situation with a lot more confidence, certainty, and bravado. And that helped dictate his results that day. And that was a really valuable lesson for myself. So obviously the environment is really important. So this is from one of the sports psychologists at the University of Alabama, Brett McCabe. And this is important for a lot of reasons for the clinician that's out there, the clinicians that are out there, or chiropractors, but it's also really important for your patients. So we need to, in our office, create an environment or a culture where we have a healing mindset. And what Dr. McCabe says is, he says, if you take a goldfish and you put them in a 5-gallon tank, it can only grow the parameters of the tank. If we take that same goldfish and we put them in a 15-gallon tank, then the goldfish can grow again the parameter of that. If we put them outside in a pond with vegetation, then literally the goldfish can turn itself into a koi fish. So the environment that we create within our offices, whether that's the music, whether that's the customer service, whether that's the culture amongst the employees, and we always say here, the healing always starts when the patient enters the office. So the first person that the patient sees, that being maybe your front office person, the healing is already starting there. So everything has got to be dialed into absolute perfection to be able to create the environment that we're looking for. So this is from a Spanish philosopher named Santillano, and this is actually from the 1950s. And what he said is, we have our thoughts and feelings of what we're trying to do, and then we have the reality of what we're actually wanting to do. Now, in our field, this becomes vitally important to be a great healer, because if we want to be a great healer, that doesn't always mean that we're a great chiropractor. Those things can be completely separate. So, and what I mean by that is the people who are getting miracle after miracle after miracle, they're able to actually change human behavior. So if we know all this information, whether we're wanting to change the diet, convince them to do an exercise, just be on board for the treatment care plan that we're going to be doing, we need them to be bought into that. So we need to be able to confront them on that. And a lot of young clinicians, or clinicians in general, they really struggle with their ability to do that. They have their thoughts and feelings of what they need to happen with the patient encounter, but there's what he called a gapnosis in reality. And so the patients aren't actually following through with what we're saying. We actually, in our office, we call that the kill rate, which means if you make a recommendation for something, whether that's a treatment plan or whatever it might be, to do the exercises or to come into the office if you're out in the town, that ability to close the deal is what we call the kill rate. And that's actually really important. That means you're actually getting to your patients. And that is a really, really important idea. And I would encourage everybody who's listening to this to imagine the treatment room is just like a stage, no different than a baseball field or a grand symphony stage, whatever it might be. Because what we're trying to do, as Mark Sanborn talks about in his book, is create an encore effect. So with the encore effect, basically, we're on 100% that people not only want to be there that day, but they want to be there for other problems that they might have, and they're willing to send their friends and family to you also. So when we talk about mastery, I got to make sure you'll be able to hear this. This is Michael Gervais. So basically, we are creating this, he used the term legacy, but through pattern recognition, as you and I make our way through the day, we should be exponentially better than we walked in that particular day. And a lot of people don't think of it that way. And a lot of people go stagnant in their careers because they're not thinking of it like so. But it's almost like a game within a game. Besides being there for a humanitarian, you have an ability to solve all these problems throughout your day, which is why I think the people that are doing it, 50 and 60 years down the road from when they graduated, it's because they have not burned out, because they are literally playing the game within the game. So like anything, when you started in trimester 1, you were what we call unconsciously incompetent. And by the end of school and then practice, you get to what's called consciously competent. And then the next layer of this is what's called unconsciously competent. This is really rarefied air. This would mean in our world that let's just say that you got an argument with your spouse, or you're having trouble with your kids or something like that. It doesn't change your treatment that particular day, because you're performing at an unconsciously competent standpoint. And a lot of people really struggle with this, with the ebbs and flows of their life. That is reflected in the treatment room. We want to be sure that we're always performing at an unconsciously competent level. Therefore, the little personal stuff that you may be going through is never being affected in the treatment room. Especially you can see the expert learning curve as you move your way through the career. We're going to have peaks and valleys as we're learning new things. We're seeing difficult cases, things like that. But we should have a positive slope of improvement as we make our way through our career. And again, what we find with a lot of the present day chiropractors, they burn out for a lot of different reasons. And what ends up happening, this line going stagnant, always be doing things and pushing the limit of what's possible for the present day chiropractor. Therefore, we never get bored. We never go stagnant in our careers. So to master anything. So Andrew Garrison, who's unfortunately not deceased, he was out of Florida State, he was a PhD. What he talked about, to master or be an expert at anything, it's gonna take some time. So 3 years a day for 10 years. But what he also said was that it's not just about repping hours. There's things that people do really, really well who end up become masters or experts. So they studied mathematicians, they studied musicians, they studied athletes. So if you can imagine now going through your day and really working on these 3 components, which would be high-level concentration, instruction, and specific training tasks to facilitate setting appropriate personal goals, monitoring informative feedback, which is really important to be sure that we're getting good feedback on what it is we're doing in private practice, providing opportunities for repetition and error correction. So that you'll do this 100 times even within one day, where maybe you do an adjustment, maybe it's just your words, something doesn't go exactly the way that you wanted it to, and you have a learning moment where you're able to correct that for the next time instead of continuing to make the same mistake over and over again. So what's neat is there actually is really good research on what allows chiropractors to be great in practice. So that's what I want to talk about now. So basically what I've done is I've condensed it down into 8 different points as I went through all the different research here years ago. But so for us to be an expert as far as a clinician, we need participation of others. This means we never talk bad about anybody within the healthcare team or even your own town. And in fact, like we say around here, we never say anything derogatory about anybody. So it's for required participation of others, and we actually encourage that. We're research and experience based, so that's kind of the future of chiropractic, basically, to use all the evidence that's out there, and also to use your past experiences. Together, we have what's known as evidence in practice. Patients are active participants in therapy, which means they are part of the process of getting them better. They need to have some ownership of their condition, whether that's home exercise, whether that could be a dietary change, but they need to be part owners in their situation or their problem. Patient-centered care. So every decision that we make is revolving around the patient being the locus of care. That's kind of the new hot button term that everyone's using, which is if you're the locus of care, that means everything revolves around what the patient's needs potentially would be. Obviously, we got to be very, very effective in our communication skills. And this is, I always say, there are some of the best chiropractors in the world that no one appreciates, and they have these tiny little practices because they simply just lack the ability to communicate well what they're doing. Self-efficacy, which we kind of touched on before, which means we're always having the patient take some ownership of their problem, share their expertise to assist others, and communicate at an appropriate level. So that means you're basically a chameleon. Whether you're talking to a 5-year-old or a 95-year-old, we want to be able to meet them where they're at, and therefore we can have a good conversation with them depending on what their needs are and who they may be. So if we look at the research even on physics, math, chess, and medical experts, they also found some interesting things. So pattern recognition. So pattern recognition to me is exactly what you and I are doing every day of our career. So you're basically walking in, you're assessing a situation, you're almost like a detective. You're gathering information. We make a decision on what we're going to do from a treatment standpoint. We re-audit the process, and that's how we basically know, whether or not only if we're helping the patient, but the next time we see that over and over and over again, we can draw back on that. So if you're a young clinician, the one thing you don't have when you're young is you don't have experience. So as you move along in your career, you're basically gaining the ability to be able to recognize patterns. I just don't have words to describe how important this is. This is what makes the best clinicians in the world. So you have constant and consistent learning moments. Those are good and bad, by the way. So you're going to fall down a little bit, but then you learn from that mistake clinically, and then we move on. And the next time we see that, then we're in a better place. Experts solve problems fast. They don't procrastinate. They have really strong self-monitoring skills, which means they're harder on themselves than anybody else. And what does that actually mean? Well, that might mean you could theoretically have a patient that is telling you subjectively they're 100% better, but functionally they're exactly the same. This will happen all the time. This happens all the time to me, where you may see them 1 or 2 times and they come back to you and they're telling you, yes, I'm subjectively better. When you audit their body, when you read joint play, when you check the trigger points in the muscles, when you check the muscle length, when you check their neuroscience, when you check their deep tendon reflexes, they're as same as they were. So there's been no improvement there. So then that means you don't have the right portal of entry. And the problem with that case is a lot of times they get off your schedule because they're feeling better and you haven't actually changed the function, which means they can quickly relapse. So, and experts learn from their experiences, we said before. I always like to talk about Bobby Fischer when we're talking about pattern recognition. So Bobby Fischer was, of course, the best chess player in the world. And the term that he used that I love was he was creating memory traces. What does that mean? That means that when Bobby was 5 years old, if you read his memoirs, he's now, of course, deceased. But he said that his opponents always thought that he was cheating. And why they thought that he was cheating is because they almost knew his next move and they knew the 5 moves after that. So he was so good at building memory traces of pattern recognition that his opponents thought that he was cheating. And all he did, and he didn't admit this until the end of his career, was he was basically noticing and paying attention to when he did something from a very young age of 5, what the next things that his opponents would do. He would always feel drawn. And think about it, that is exactly what we're basically building memory traces. We're noticing the amazing relationship when you manipulate someone's subtalar joint, how you potentially could change range of in the hip joint. You move someone's thoracic spine really well, and you determine how that changes external rotation of the shoulder. You adjust someone's upper cervical spine, and you notice that how now they can open their mouth wider. We're doing this every day of our career, but because we're not auditing it, and we don't have an auditing process, we don't even know, and we can't relate to the patient all the miracles that we're creating for them. And so the auditing process, which I think is so important for all of us to be doing, not only helps you with patient care, but also just helps yourself in building the confidence and the certainty of the miracles that you're creating every day of your career if you're paying attention. So, and how do we continue to master this skill? Even if we're just talking about manipulation, manipulation is a lifelong journey to be great at. Notice I said to be great at, because of course a lot of people are good as they leave their chiropractic college education, but to be really good at it, I mean, it is an absolutely journey. So I always talk about what Dave Ramsey says in money management, which he says basically you need to tell your money what to do. But as you start to have kids and you start to get busy with your practice, you don't have 3-hour blocks anymore. So what you need to be able to do is you need to be a master with 15-minute compartments. So if you were to ask me, I'm 35 years old, let's just say, and I'm busy, we have kids, I'm running them around. You have to master 15-minute compartments instead of playing on your phone, instead of like doing a low impact things. We need to be doing things that don't require huge amounts of time, but we can block it up into 15-minute compartments. And that, in my opinion, is one of the keys to mastery. We need to be able to prioritize. So what that means is if you're gathering information on your cases, so maybe you know where the joints are restricted, you know where the key trigger points are, you know what the key functional tests are. We could find a million things wrong with every one of our patients, but the best physicians in the world, they're able to prioritize their information. So that means they have a quicker pull of injury, which means they get results quicker. And I actually kind of stole the idea or concept from Mary Kay. I actually treated the #1 Mary Kay lady in the world, and when she walked in the room, you absolutely knew it. But she gave me this book, and in this book, she talked about Mary Kay. The most important thing that she would talk about is when you wake up in the morning, make a list on a Post-it note and list the 6 most important things that you need to do. And if you act in priority at the end of the day, celebrate by having a glass of wine or a drink or something to celebrate because you acted out of priority. So, but I do think like as far as the time management and then even in the treatment room, your ability to prioritize information is critical because that basically determines what the portal of entry is going to be on that case. And that will allow you, again, to get quicker results. So when we talk about situational IQ, situational IQ, we always talk about with athletes. You'll hear names like Michael Jordan, Wayne Gretzky, and they were absolute masters on the athletic field. And but you and I, it's basically no different. So when we walk into the treatment room, again, we're gathering information, we're making a decision that we're going to do. And the other thing was some of us are in high stakes environments. So you might be working with a college or a professional team, a professional athlete, or some big politician, whatever it might be. So anyone that would potentially maybe get you a little bit worked up or nervous can you give your best performance on the biggest stage? And what you'll find about a lot of human beings, they're actually unable to be able to do that. So the tighter or the bigger the moment gets, sometimes the performance gets decreased because of that. But as far as situational IQ goes, you and I are basically doing the same thing, because we are gathering the information and we're having to make a decision to, of course, help the case. So that is easier said than done, but as you move along in practice, people get better and better at that. So maybe you're like me. I was really good at the rote memorization parts, so chiropractic college wasn't that difficult for me, because you could just memorize something, regurgitate on tests, and then dump it. Well, as it turns out, to be really good at what you and I do, it's all about critical thinking and reasoning. So I had to basically rewire my brain to be good clinically, in my opinion, because I just wasn't very good at this skill, because I would be used to just being able to memorize stuff, regurgitate it, and move on and pass the test. Whereas critical thinking and decision making is, again, about pattern recognition and those type of ideas, and is completely different than what it takes to be good at chiropractic college, in my opinion. So critical thinkers become skeptical of quick fix solutions, of single answers to problems and claims of universal truth. We also become open to alternative ways of looking and behaving in the world. So for us, and everyone's is going to be a little bit different, but we have what's called, this functional triage. So if you look at a really good emergency room, what will make for a good emergency room is the ability of the physician in the ER to be able to look at the situation, determine whether or not it's actually an emergency, and then triage appropriately. For example, if you are in the middle of a heart attack, then that is a completely different triage situation than if you have back pain from mono, or maybe even if you had a broken leg, whatever it might be. Those are handled completely differently. And one of my buddies who's in charge of the Mercy ER rooms here in St. Louis, he said, and the reason this story is important is because he actually, the Mercy in St. Louis is considered to be one of the best at emergent medicine. And he said one day, so they're known for having the best systems in their emergency room. And he said, whether or not you would survive a car accident if you showed up at Mercy ER room completely depends on who the attending ER doc is that night. And it really shocked me, because he had just gotten done kind of bragging about, how good their systems were. And what he followed up the discussion with was, he just said that you still are using situational IQ. You still have to make like game time decisions to, save somebody's life. And so maybe what you and I are doing isn't exactly life and death, but it's basically how you're able to mix and match all the different techniques and things that and getting people better. And whoever does the best job of that potentially usually gets the best results. So these are kind of ours, but everybody's will be different. I'm not here to tell you that this should be yours. But whatever the different techniques that you're doing, it's your ability to use these at the right time over a treatment plan that will help you a lot. So, and it's really important, especially if you're young. I think a lot of young clinicians make the mistake. They're going to do all of these at one time. And the mistake in that is, if they try to do all these different things in one visit, is that the patient doesn't get better. You don't make money. So it's a double whammy kind of situation there. And you're just unable to, get enough patients in to be able to make the whole financial side of it all work. So your ability to triage the patients appropriately and use the right techniques at the right time, even within the same treatment plan, will help you, one, make hopefully a decent income in doing this, and also be able to see more patients. The readiness. So if we're talking about like our more difficult patients or our chronic pain patients, we have what's called a readiness ruler, which means a lot of our patients are just not ready to get better. So if you're in the business of trying to create miracles with your cases, you're going to need them to verbally say that they're 10 out of 10 ready. So we use this quite a bit with our chronic pain population, because if they're not ready, for example, to make a dietary change, to start a walking program, to sometimes even get to 4 weeks of treatment, then it becomes really hard for them to actually commit to what it's going to take to get them better. So if you're dealing with a very complex chronic case, and getting better is number 12 on their list, then I would simply tell them, no offense, but when you're 10 out of 10 ready, then we'll get going, and then we can have a great outcome. So having that more difficult case that's chronic with a lot of complexities to get them to commit to being 10 out of 10 ready, I think is imperative. And I don't have the words to describe how important that is in certain cases to make sure that they're ready. Have a plan. So one of the things that patients will always gravitate toward is a clinician or a doctor, no matter what the discipline is. Now we're obviously talking about chiropractic, but do you have a plan? And I always pull this picture up with Sully, because on this given day, I personally did not even know that you could land a commercial plane on a body of water like the Hudson River. But as it turns out, you can. But as it turns out, there's not that many pilots who actually can do this also. So on that given day, Sully had the day of his life. Talk about situational IQ. So we always talk about with the athletes, and we were talking about at the treatment room, but this is true for basically all walks of life. So to be able to have that moment where when the pressure's on, you're able to make a bunch of good decisions, you're able to have a plan is really important. But with your patients, they actually are going to want a plan. And I think this is an important thing to talk about, because a lot of times the chiropractors are scared to tell them what that plan is. So in our office, for example, we'll do 2 or 3 times a week for 3 weeks. And then at that 3-week mark, we reevaluate them. And for our interns and our young associates, they really sometimes struggle with this. So really what we tell them is, 1 out of 100 people might balk at that, but that 1 out of 100 you certainly probably don't want. But what most people want is they want to know, what does this look like? And through the sports world, I've been lucky enough. I've been around some really good, not only people that are doing what we do, but also like orthopedic surgeons and things like that. And one thing I've picked up on that they're all good at, the ones that are really good, is they're really good about telling the athlete or the client or the patient what their case looks like today, what it looks like a week from now, what it looks like 3 weeks from now, a month from now. And when you have a plan, then people are going to be on board for the expectations of what's about to happen. And I think a lot of young chiros, they make a mistake by they may put them on a treatment plan, but they don't tell the patient what's going to be happening. And most importantly, they don't tell them the why. If you want really great compliance and whatever you're doing to the patient, start learning to tell them the why of everything, instead of this is what I'm going to do. In chiropractic, we're notoriously not good at this. So we'll do a report of findings and we'll say, this is what we're going to do. And if we would just simply tweak our message and tell them the why, then we would immediately have better compliance. So I think that is really, really important to tell the why of the situation, not just what you're going to do. And then when things aren't going the way that we want, it's almost like in football here, famously, we have Peyton Manning calling the audible. Then we can immediately be able to switch what we're doing when things aren't going well. Now, you are going to be stuck if you don't have an auditing process of the patient. That's why I think this auditing process is so important, because sometimes the patient's coming into you, let's say they're functionally, they're not better, and they're telling you they're not better, then we need to be able to make a change. But if you don't do a good job of auditing the body, then this change becomes really, really difficult. And just to kind of say it a different way to reverse engineer it, what can happen oftentimes is you will have a patient who, like I said earlier, they're 100% better from a pain standpoint, but you haven't changed the function at all. And that patient is a difficult patient, because in the next couple of weeks, they're probably about to relapse. And whether that they come back to you probably just depends on maybe your personality, maybe your jokes, maybe your good looks, whatever it might be. But they a lot of times will oftentimes end up not coming back. And the reason is because they would tell people that, you were unable to help them. So, and the other thing is, if you're changing function and we're not changing subjective results, or they don't think they're better, but you're actually making great changes within them, then what that can mean is either they're in the chronic pain classification or hospital. So maybe we need to tweak a little bit what we're doing. Maybe they have multiple autoimmune diseases. Maybe there's been former abuse. There's just something that is making them more of that chronic pain presentation. or they potentially have a structural problem that you and I might not be able to immediately help them with. So let's just say that, someone comes in with thermoacetabular impingement of their hip joint, they have a labral tear. You do 4 weeks of great treatment. You're manipulating things that are stiff. You're changing the soft tissue function around the area. You're teaching their brain how to better activate the muscles around there. And you get done at the end of 4 weeks and they tell you I'm exactly the same, but functionally they're 100% better. Then we're not going to be able to help everybody. So basically you did your job. You changed the function. And what the world is clamoring for in our world is really good world-class trial of care. Because the trial of care is what's going to determine whether or not they would potentially need the next intervention. The one thing we know about imaging is that the more severe the MRI findings, the X-ray findings, the CT findings, doesn't always guarantee that they need the next level of Western medicine. So in saying that, all you're really left with is your ability to give world-class treatment, and then we're able to make a decision if they need the next step. So it's beautiful, really, because all you and I are able to do is change the function of what's in front of us. And in fact, I keep it so simple in my mind. I think when someone comes into us, what do we need to do? We need to be able to get joints moving that are stiff in the right planes of motion that they're stiff in. So that would be obviously an adjustment or manipulation. We need to maybe do soft tissue work if there's adhesion, fibrosis, densification, trigger points, tension, tone, whatever it might be. And we need to also probably find a better way for the central nervous system to reorganize the muscles around whatever joint we're talking about. That's all the tools that I have. So I really, at this point in my career, I don't put any more pressure on myself than that. That's all I really, it's what I know to do. So if I can do that, then that's going to help me sort out all of the other potential more difficult cases, like a structural finding or maybe like a chronic pain presentation. And a great quote from Mike Tyson's trainer that I love this. Everyone has a plan until they get punched in the mouth. So, when the bullets start to fly and we have to, things aren't going the way that we want in a case, can we say the right things to keep them on board to change function, right? So I'll talk about that in a couple slides here, but it's really, really typical for the young clinician to make a mistake where you didn't have a chiropractic miracle, they're not having surgery, so they're stuck somewhere in the middle there. So what we need to be doing with those patients is just to continue to change function with them. So what we do at our office, which has worked really well over the last 20 years, is we see everyone 2 times a week for 3 weeks, and then we reevaluate them. So if we change function, if we change pain, at that point we can let them go. The typical scenario that's not talked about often is after 3 weeks of treatment, they're quite a bit better, but functionally, so subjectively, they're 90% better, and functionally, let's say they're 75% better. They just need more of the same. They just need more management of their condition. So everything that you've been doing has been great. You can maybe make a couple tweaks, or honestly, you could just keep doing the same thing since you've had some success. Or we have no change in function and no change in pain. That could mean a referral to maybe a functional medicine chiro, maybe a medical doctor, do some blood work, get some imaging. And then if you start beating the functional drum, which I would recommend, you will have a lot of people that are going to want to stay with you on some kind of maintenance program. Therefore, if they can understand exactly what it is that you're doing for them, then they will be there. But if you do a bad job of explaining exactly what the contemporary chiropractor does, then they don't know why they're there. And the second they're out of their severe pain, then they're obviously wanting out. So if you do a really, really good job of educating them on this, then really a majority of people will actually want to stay with you, because what you're going to find is people need maintenance treatment just because of life on the planet. You have future injuries, life is hard, you sit for 12 hours of your day, you sleep in disastrous positions, you play sports, you do all these things. So you and I are in a unique opportunity where we're in a position to actually to do things to help manage these patients. It's no different than a cardiologist. So if someone has a heart problem, or maybe you're a metabolic type 2 diabetic, then every day stuff gets done to manage your case, and the human body is no different. So I feel like especially in the evidence-based circles, we're not great at educating our patients on what we can be doing from a functional standpoint. And I'll tell you the mind trick that I play with myself that has really helped out me a lot. For those of us who work with pediatric patients, if you took a 10-month-old baby, and you can imagine them being in front of you right now, if you felt their soft tissues are perfect. There's no trigger points, there's no tension, there's no tone, there's no densification, there's no adhesion, and the joints spring beautifully. So that is what perfect joint play feels like. So I always compare that to the patient that I'm seeing, and I ask myself, is the 80-year-old stenotic patient that I see today as a new patient, am I doing a good job of returning their body back to that state? Am I ever going to get there? Probably not, of course. But in my mind, that's what I'm thinking that I'm doing. And as you can imagine, this takes more time than you would think. So this is how, like, if you really are a functionalist, you cannot change function in a visit or two in a lot of your cases. You can change pain in a second. But to be honest, Western medicine does a better job of changing pain because we can inject the joint with cortisone. We can give you prednisone orally. We can give you opioids to make you not feel your pain. So you and I are playing a different game. We're playing the functional game. So what we have as tools to get you better is to get joints moving that are stiff, is to teach your brain how to activate muscles better, to maybe do soft tissue techniques. That's what's in our toolbox to help you. And if we don't do a good job with that, then of course we can use Western medicine to help us. But I think a lot of the evidence-based group, they're cutting their patients off way too soon because they haven't actually restored function, which gets us to this crazy conundrum right now, philosophically, is when is your patient done? So if your patient is done when they say they feel better, then you're basically no different than a chiropractic aspirin at that point. So what I would encourage you to start thinking about is, are we actually restoring the joints back to normal? Let's just say that you're 80 years old and you have a stiff thoracic spine. I can't go for broke today and just, give them all the force in the world because that area hasn't moved in so long. I will literally break 8 of his ribs if I do just a full-on adjustment today. But I slowly but surely, maybe I'm mobilized, I'm doing light manipulation, maybe we're utilizing the flexion distraction table, slowly but surely starting to get movement there. And then 4 weeks from now or 6 weeks from now, I will be able to release that joint that won't cavitate. And I didn't know that when I was young. I was very impatient. I thought that I could fix everybody in a visit or two. And I kind of learned as time went on, if you really, really, really want to change function, you've got to give yourself enough time to be successful, which means you have got to be able to confront your patients, because you can be the best chiropractor in the world, but if you're unable to keep them on board for the changes you're trying to make, they're gone. So therefore, you don't get the results that you could be getting. So one of the best ways to master clinic care is to take the schedule home the night before. A lot of us now use electronic health records, so you have access to your schedule. And this is one of my secrets, I think, to maybe some of my success was I'm always paying attention to who I have kind of on board. I'm even like if I'm driving home, I'm thinking about my difficult cases. I'm thinking about, something, maybe an old patient that I haven't seen in a while. And if you almost can almost revel in your successes and your failures, I think that really goes a long way, because I can't tell you how many times I've been on a long walk or I've been in the shower and something just snaps in my mind to think about, wow, I could have done this better with the previous case. And I think that's like great clinicians are able to, they're able to just constantly recall things that they've done to help them in their future cases. So when we're talking about confrontation, tell the patient what they need and why. So remember, less what, more on the why of the experience. For example, you have a difficult case of acid reflux. You have, let's say, a 50-year-old man who comes in a tie, who would, typically be the last person you'd expect to be able to make a bunch of dietary changes, let's just say, very impatient personality. So I just say, if he's got acid reflux, and I were to say, hey, I don't want you to take this proton pump inhibitor, your Prilosec, and I just leave it at that, then he's going to basically tell me to screw off. But if I say, hey, Mr. Jones, did you know every time you take that proton pump inhibitor, you're actually masking the symptoms? And the problem with that, our patients who are on PPIs, their esophagus is still very much inflamed. So because of that, they're at much higher risk, like 300% more risk for esophageal cancers, stomach cancers, all GI cancers, rectal cancer. So what we want to do is we want to do a little bit of blood work and probably find out why you're having this acid reflux. And there's always a reason why. So what I did just there, I told them the why of the experience. And I can tell you right now, that difficult patient who won't listen to you, you frame it that way and you will get immediate compliance in those people by doing a great job of explaining the why. I always imagine finances aren't a barrier, so I just tell them what I recommend from a treatment standpoint. I'll let them sort out the finances. If you want to make a deal with them, fine, but I definitely would not let the finances get in the way. I would just tell them what they need. No preconceived notions on the patient, so don't judge a book by a cover is basically what that's saying. You control the treatment plan, not the patient. So this will happen a lot. Happened to me often when I was young, where I'd make a recommendation, they go up front, and when they made their appointments, they would, instead of being with me 2 times a week, they would only do once, or whatever the example might be. So they're basically running the treatment plan at that point. So we don't want to do that. And this goes along with that, do not shortcut the treatment plan so they can afford it. Just if you have to, on some cases, you'll just tell them, well, you could either, see me when you can afford it, or you could, cut them a deal, but it takes away a lot of your credibility. And all of a sudden, then you're like, well, I guess we can do half the amount of visits, because then you're basically undercutting what you had originally said. And if they do shortcut the treatment plan, I always do address it. Rapport. So the research on rapport is insane. So when they look at doctors, so effective rapport has been shown to improve patient compliance and treatment clinical outcomes and patient satisfaction. So they actually studied it. They found that rapport is established the first 13 seconds a doctor enters the room. And if you look at this is where this just boggled my mind the first time I saw it, but now I do believe it. So when we walk in the treatment room, the initial rapport, 93% of it is nonverbal, meaning it's not anything that the doctor says. So what that means is when we walk into the room, do we have a smile on our face around here? We always say smile with your eyes. Are we exuding the message of wanting to be there to help them? Are we acting busy and uninterested? So all these little things become really, really important in immediate rapport. But I think what is so fascinating is just that only 7% of it is what you say, and all of the other rapport is nonverbal. Reassurance. So once we know that we can help this patient, we want to start weaving reassurance into the case. And I will tell you, the best clinicians in the world, this is one of their gold medals that they may or may not know that they even do. So and again, what we're going to have is every one of us on this call has probably had the chiropractic miracle, whatever it is. You give them a magical adjustment, they get up, everything is perfectly fine, and it's just amazing and awesome. And then on the other end of the continuum, we have surgery. So you have your chiropractic miracle, and then you have your cases that are going to surgery. And statistically, the cases that you're seeing that will go to surgery for most of us are literally less than 0.01%. So in the middle there, we have a black hole, and these patients are not being managed well. So the patients that fall into this black hole, then we need to continue to work on changing function with them. And this can take time. But if we do a really good job of changing function, then eventually we're able to turn the corner. And I like to tell my patients, it's like, we don't put braces on your teeth, and the next day you wake up and your teeth are straight. It's a little bit of a process. And I think that is a hard thing for a lot of the young clinicians to kind of grasp. But to be great at changing function, you're going to need to give yourself a little bit of time to be successful. And that's one of the biggest mistakes I see in the evidence-based group, where they just simply, they're doing great things. They're just have not confronted the patient enough to get the results that they need. They haven't given themselves enough time. When a healthcare provider offers a few encouraging words about their patient's recovery time from an allergic reaction, symptoms are significantly reduced. So once we know that we can help them, a common thing that I say a lot is, I've seen this literally a million times, Mr. and Mrs. Jones. This is what you can expect. I will definitely be able to help you. And if you're not going to be able to help them, like, which is the case sometimes, then I'm 100% honest with them. But when you can offer reassurance, this is one of the secrets to like really good orthopedic surgeons and chiros, physical therapists, whatever it might be. They're always offering reassurance to their cases, and then the healing is actually starting at that moment. So very important. Providers explicitly stating to patients that a treatment will improve their condition makes it more likely that the treatment will do so. Just like, we do acupuncture here. I'm not so certain that, like, if I want somebody to quit smoking, that it's just me sticking a needle at a certain point in their ear. But if I tell them, when I put this needle in your ear, you're going to quit smoking, then I get a completely different outcome. So we use this to our advantage, and we actually start this with the reassurance policy. So we always call this the 2 R's. I would maybe take away from this message would be rapport and reassurance. So if you can work on those 2 things, I think that's one of the secrets of, and the differences between the great healers that are getting miracle after miracle after miracle, and just maybe the great evidence-based chiropractors who are getting good results, but they're not getting maybe the miraculous results. So clinical excellence. So this is those of you who have maybe heard me talk before. I am all bought in changing the function of the case. In fact, so much so that when I walk into the treatment room, for the most part, I don't ask them about their pain. I simply ask them how, or I go to the case to see how they're actually functioning better. So I do this a couple different ways. I will walk into the treatment room. Let's just say that we're talking about joint blockage, and I'll ask how the day is going, but I won't ask a question to see like how their overall case is going. So I might immediately go in and spring the joint to see how the actual biomechanics are. That's the first line of questioning. The second line of question is, I'm going to take one of their activity analysis. Let's just say that there was not a case and they were saying, well, so I'm going to ask, the next line of questioning is about their function. So have you been able to walk to get your mail now? Can you walk a little bit further? And there's all kinds of examples. Can you get through the night of sleep? Can you chew now? Whatever it might be. That's the next line. So the first line of questioning was just going in and checking what the big finding was that you had found the first time you were with them or the last time. The next thing is their function. And then finally, the third thing is, if you get there, would be subjectively, how is their pain doing? And that is exactly opposite of what we're all kind of taught to do. But let me just tell you how complex an individual pain it actually is. If you were at the ocean right now and a shark was to take off your arm or leg, do you know that you would feel zero pain for 3 hours? If I took this paper here and I paper cut up my finger, for the next 3 hours of my life, the paper cut would drive me nuts. So if I have a paper cut, it drives me nuts for 3 hours. If a shark takes off my leg, I feel no pain. Now at 3 hours, then you start to feel quite a bit of pain with the limb amputation, but you get the point. And this is why we need to be very, very careful of putting too much credence in what the patient is saying, because as you know, giving humans a chance, chiros are wonderful listeners. They will bitch. So people could, they could have an argument with their spouse. They could have 3 autoimmune diseases. They could have a history of horrific things like abuse, and all of that can manifest itself on how they're reporting back to you that they're doing as far as their case. That is fine, but we got to be able to sort through all this and know how they're actually doing from a functional standpoint. Therefore, we're able to better help the patient. This is what I say all the time too. If I had an MR scanner right here, right now, or I could have a 3-week trial of care, I would pick the trial of care every single time. Because again, the image findings tell a piece of the story, but not the whole piece of the story. What I really want to know is if they have treatment with you or me, or they have somebody who's hopefully doing a good job, then we want to know how they're responding to their treatment. And that actually means we become less interested in their image findings. So within session reassessment, it becomes really important. This is just what I told you before on the auditing process: mechanics, function, and then finally symptoms. So what are the audits? I told you mine. A lot of you guys will know how to do things that I don't know how to do, but these are the audits that we do. So we use joint play, we use trigger points and soft tissues, tension, tone, muscle length, functional test, a really good neurologic examination. And I will come back to all these things before and after the treatment to make sure we're trending them in the right direction. Again, things aren't going to be perfect in a visit typically, but I'm going to point out to them how these things are slowly but surely getting better and what it is we're trying to work at. Remember, we're going to tell them the why, not the what of the situation. So systems and routine, especially as a young clinician, can be very helpful. So, but then at some point, the systems and routine can actually limit you, because as you're becoming a great clinician, things become redundant and sometimes things become a waste of time. This happens often to the seasoned clinician where you feel like you're taking a bunch of shortcuts, which you might be doing. But what happens a lot of times, you're actually not taking shortcuts. You've actually earned the right to take a shortcut. And I don't know if you realize this or not, but as it turns out, the more patients you see, typically the more money you make. So if we're able to see more patients and still get a world-class outcome, then you're able to see more patients, which is good from a humanitarian standpoint. And then, of course, you're able to do better from a financial standpoint. And then as far as certainty goes, again, this is so important for getting good results. And what I like to say is, imagine if you were as confident and certain about your functional findings as the orthopedic is about their structural findings. So great walks in all walks of life, you'll see that they possess certainty. So we never want to be considered cocky. So you got to watch that. So don't get your C's confused, but we want to be certain and we want to be confident. Imagine an orthopedic surgeon who is so confident about the ACL tear or the medial meniscus tear, they will simply just do their, they'll do their report of findings. And of course, you're just there like, okay, yeah, I'll have surgery to repair my ACL. Imagine if you had that kind of confidence with your functional auditing process with these things here, and you were able to exude this, then the patient would understand why they're, of course, there. Likability, as it turns out, to be a good clinician, then you have to be likable. In Tim Sanders' book, they found out that the most important things were obviously to be friendly, to be relevant. Of course, as a healer, we need to be somewhat empathetic, and we want authenticity. So we want realness, and people don't want to feel like they're being sold something. They shouldn't feel like you're buying a timeshare or steak knives or something like this. You should be able to exude it and explain it well enough to where there's just really a natural way of doing this. So the studies on physician warmth, qualities like friendliness, honesty, trustworthiness, good-naturedness, empathy, and kindness, they've actually studied this. These are all things that help dictate and help you getting results. If you look at the NCMIC, when doctors actually get sued, one of the things that physicians who get sued often don't do a good job of is this physician warmth. So even if you were to make a catastrophic mistake, which we hope that you never do, but if you did do that, as long as you had exuded these other soft signs of patient care, a lot of times that potentially could protect you against a lawsuit. Here's James Andrews. He's the best orthopedic surgeon in the world. And this is the father of orthopedic surgery. This is on our podcast. It's called Gestalt Education. Listen to him talk about what we're talking about now. So there is the number one orthopedic surgeon in the world telling us how important those traits are. That's why he is just beloved by all professional athletes. This is Michael Gervais again talking about presence. So one of the best practice management tips I can give you is to be present with your patients. So he is the sports psychologist who worked with the Seattle Seahawks, the Red Bull athletes, and many professional athletes. I've sent him a bunch of people. And so the present time moment is so critical, and a lot of us struggle with that. We're either thinking about something in the past that we can't change, or we're thinking about something in the future that's not going to happen to us. In the last 60 minutes, we've made an attempt to kind of walk through all these soft signs of getting great results in the clinical situation outside of being a great clinician. So I hope we're able to establish what your it factor is, and you're able to hone that in the next couple of days when you get back in the treatment room. And in saying that, I want to thank you for having me, ChiroHealth, to Jay Greenstein, and to everyone who was involved with getting me on. And I hope to see or hear from you soon. Thank you.
Thank you so much, Dr. Brett. And thank you, everyone, for joining us today or watching this recording. And I just want to remind you that our next webinar is going to be on Tuesday, November 14th. In 2 weeks, same time, same place, we're going to have Dr. Jody Dinnerman. She's going to be talking about battling burnout, which a lot of people have been experiencing this year, and what she did to find joy in her practice again. So until next time, everyone, have a great day and a rest of your week, and we'll see you back here in 2 weeks. Bye, y'all.
Thanks again.